Hi.
Hi. So now we'll move into the patient panel portion of the conference where we will welcome three lupus patients to share their experiences with cardiovascular involvement. Please keep in mind that lupus is a very individualized disease, and therefore the manifestations of the disease and the treatment options can really vary greatly from one patient to another. We'll hear about their personal experience, but of course, our patients are not here to give recommendations. The recommendations are best given by your own doctor assessing your own condition. I'm going to kick it off by asking some questions, and I invite each of you on the presenters on the panel to share their experiences as it relates to the question. And if you're at home watching this, you can type your questions in the Q&A area at any time, and we will ask them after the presentation. So we're very pleased to welcome Yvonne Gray, who you heard speak earlier, Amber Shepard, and Mary Kay Francis. Welcome, ladies. The first question I'm going to pose, and I invite anyone who wants to share, is which heart-related issues have you experienced since your lupus diagnosis? It could be symptoms like chest pain, high blood pressure, irregular heartbeat, blood clots. Please feel free to share what you've experienced so far.
I could start. Ever since I was 15, when they suspected lupus, but it was inconclusive because this was in 1985. They put me on a blood pressure medication. And so I've been taking blood pressure medications since I was 15. So, um, different ones. I had to stop one because it's causing coughing. Up until now, I'm 54 and I can't control my blood pressure without medications.
Mhm.
Um, it runs in my family, so it's genetics. Um, my father has high blood pressure. Well, he passed away. My mom has high blood pressure. She's doing dialysis now.
Mhm.
So I think mostly it's genetics. I have gone plant-based, but I do eat salmon for several years now. But I can't beat I can't beat my blood pressure, even though I'm exercising. I walk my dog like every day for like maybe up to half an hour.
Mhm.
And he does pull me a lot, so I am walking briskly. I do ride my bike, a stationary bike on a trainer, but it's hard to beat this blood pressure, even though some of the blood pressure medications, they're not working. So I'm doing everything right, but nothing is helping me reduce my blood pressure. So
It sounds like you've got all
yeah,
the lifestyle factors and
yeah,
you're taking the meds. So
yeah,
you're,
it's very frustrating. So
yeah, yeah. Does anyone else want to share?
I can share next if that's okay.
Yeah, please go ahead.
For me, I take blood pressure medication, but for me, I take it because I have thickening of the heart wall. So the muscle pumps too fast and it's causing a huge thickness in the heart wall, which can be problematic down the road for me. So I take actually two different kinds of blood pressure medication in hopes that it will open the blood vessels up enough to not continue to thicken more or it's
Mhm.
going to become a severe problem for me. I think that started maybe 10 years ago, 10-ish years ago. Um, so I don't have like the technical blood pressure issues. My blood pressure is actually pretty good, but I get like pericarditis, endocarditis. I've had blood clots, a few blood clots. I had surgery last year to take my medical port in and out twice due to blood clots because I had them in both chambers of the heart and in my medical port as well. Um, and then, sorry, you guys, my cats are in the background. Rough housing. So I don't know that I would say I would have the high blood pressure side, but I tend to have like the inflammation of the heart sac, inflammation of the heart, and the other issues that come, like the heart thickening and the blood clots for me.
And does the inflammation, Amber, does it come and go, or is it like a constant?
It comes and goes. So
Mhm.
it'll be like I'll have some chest pain and then I'll be on medication for a while for that. And I'll get the inflammation down for that. And then it'll be good for a little while. And then it's almost like a flare. I don't know
Yeah.
if it comes with a lupus flare per se, but it does come on and off. I've had it like at least half a dozen times in the last few years, maybe
Mhm.
last 5 years. I've
Mhm.
had it where I've gone into the hospital thinking, oh my gosh, I can't breathe. It hurts so bad. And
Yeah.
it'll either be the endocarditis or the pericarditis.
Okay. Yeah. Okay. Thank you for sharing. Mary Kate? Oh, you're muted.
I'm sorry, I didn't realize I was muted.
No, that's okay.
I'm Mary Kate, and I got lupus when I was very young. I was 21, and way back in 1964, and they didn't know anything about it, back then. So it was very scary. And, I was reading out of the same books that the doctors were about what to do about this. But have had the lupus over all these years, and other things have been added as I go along. Raynaud's came in there somewhere, and then antiphospholipid syndrome started when I had a TIA when I was about 59, and they made me stop working and
Can you tell us what that is? Sorry, what is a TIA?
a temporary ischemic attack. It's like a very mild stroke.
Mhm.
Um, And so at that point, they put me on Coumadin. So I've been on Coumadin since, you know, my 60s. And now I'm 81. And so, and I've always had to take Coumadin. I was never able to take the other kinds, the kinds that you don't have to be tested in between. So I still get blood tests, you know, um, for the Coumadin when I have. Sometimes it's only once a month I have to go. Other times I have to go once a week when my numbers don't stay steady. It's very dependent on what I eat, my
Mhm.
Coumadin level.
Mhm.
So, but it's not painful or anything. So, you just make it a part of your life and you go on because what other choices do you have?
Yeah.
And then in when I was 75, a few years ago, I had a silent heart attack. I didn't know I was having a heart attack. I didn't, I knew it wasn't a stroke. And so I was relieved about that. I could tell from the symptoms that I wasn't having a stroke. So I ignored it and I didn't do anything. And I went to bed, and the next morning I felt fine. So I didn't even mention it to the doctor until a couple of months later when I had an appointment with her. I told her what happened, all these different symptoms that I had. She,
What were those symptoms, Mary Kate?
I was sweating and
Oh.
I never perspire. I
Mm.
almost never perspire, even when I'm exercising. So
Mhm.
that was unusual for me to be sweating. And I felt an upset stomach, like I was going to, throw up or something, but I didn't. And I was at someone else's home, of course, and with other people there. And I was the youngest person, and I was driving all these other people, what we were doing. So I really couldn't afford to be sick. And so I just ignored it. And that was a mistake because when they tested me a few months later to see with an echocardiogram, I had damage to the bottom muscle of my heart. It was not pumping enough. My ejection fraction was very low. That's the number they base this muscle strength on.
Mhm.
So ever since then, I've had the heart issues. And I have lost 30 pounds of weight,
Mm.
mostly from fluid, when they put me on all these diuretics to keep the weight off. Um, but I have been treated at Stanford since I had the heart problems. And I like my cardiologist very much. And I feel like they've got me on the right medications. I have no energy at all. I used to be a very high energy, very fast moving person who was never sat down, you know, that kind of very high A type personality. And this thing has just said, nope, you can't do that. So for a while, it started during the pandemic.
Mhm.
You know, between being home all the time because of the pandemic and thinking that I just have no energy, I can't do anything except go from one piece of furniture to another.
Mhm.
Finally, when I got to the doctor at Stanford and they said I should try to get more exercise, they put me in a cardiac rehab over
Mhm.
here in Santa Cruz. I live in Santa Cruz, so it's a long way to go to Stanford.
Mhm.
Cardiac rehab. So they
Yeah.
put me in the one in Santa Cruz, and I go 2 days a week, and I do 35 minutes on a stationary bike, 15 minutes of stretching with you know, what do you call them? Bands, bands for your arms and upper body.
Mhm.
And the third thing is balance exercises. And it has made a huge amount of difference. I still don't have any more energy than I had back in the beginning when this started several years ago now, but I can work around it. My body is finding ways to be able to have me be able to live pretty much the life I was before. I can go out to lunch with friends. I can still drive. I, you know, I just can't do 5 things a day. I
Mhm.
should just do one.
Yeah.
When I try to do three, I get in trouble.
Yeah.
So, but I'm under good treatment. I take tons of medicine. I probably take like 15 to 19 pills every morning and then different ones at night. But I've been used to that because I've been on, you know, with lupus for so many years. I was always taking medicine. And
Mhm.
I'm grateful for it. I'm grateful that I have it. I'm grateful that I can afford it. And I'm just grateful for the life I have. I have 4 children. I know some people with lupus have never had any.
Mhm.
They found it right after my first child was born. I
Mhm.
broke out in the rash. And she now just turned 59. So, so I've had it a long time. And they said most of my heart problems are just due from so many years of inflammation with the lupus that it was bound to happen. And they told me that, you know, 10 or 15 years ago when I asked, you know, if I was going to be in a nursing home for a long time, because we were trying to figure out how to do that financially. And the doctor said, no, I doubt it. He said, you will probably die from a heart attack. And I said, oh, my heart's been fine. I have never, no trouble with my heart. But, you know, at 75, it started. And that's when about as long as my body could go without showing the effects of the inflammation of 50 years, you know.
Mhm.
So, but like I said, I'm very grateful for what I have. I'm grateful to the lupus group. I've been a part of them for at least, well, since I moved to California in 83, I've
Mhm.
been in the lupus group that meets at El Camino Hospital. And you probably know Robin, who just won the Volunteer of the Year. She's the leader of our group. And it's a wonderful group of friends. And there are only maybe a dozen of us, but we get together once a month now on Zoom
Mhm.
and talk about just how we're doing.
Yeah.
And it's been a great experience. And as I said, you know, I wouldn't ask for it if somebody said, could I have a life without lupus? Of course I would like that, but um, it is what it is. And you just have to find a way around it. If you have the will to live and to have a good life, you can live with lupus successfully.
I love that.
Thank
That's very inspiring. Thank you so much, Mary Kay Francis. And
Sure.
one thing you mentioned that I think is a good segue into the next part is You know, you said, I can't do 5 things a day, I can do 3 things a day. And I think for most of us lupus patients, like being tired a lot is like such a common symptom. And I'd love to hear from you or anybody else. How do you manage your energy, and how do you kind of prioritize the things that you want to do on a day-to-day basis?
Um, for me, I write down a list
Mm,
and I prioritize which is most important.
yeah.
But sometimes I get off it, you know, I
Go
get
on a tangent.
distracted a lot.
Yeah.
You know, I'm like, oh, maybe I should do this. And then I notice that I didn't finish something. I'm like,
Mhm.
oh, I gotta finish that. So it's hard. It's hard to make a list, but I try to stick to that. Um, yeah, so that's how I manage. I try to manage, but sometimes you get distracted. So
I
I
like
admit it.
I learned that too. It's like write down the 3 most important
Yeah,
tasks of the
exactly.
day, and then everything else is like, you know, it'd be
Right,
nice, but don't expect to get it done.
right.
Which is what Mary Kate Francis said too, you know, your 3 tasks. How about you, Amber? How do you prioritize energy and the things you want to get done?
Well, I kind of found it interesting because after I was listening to Mary Kate, I thought, oh, I forgot about a couple other things. I
Mm,
did CIA also, maybe a little over, maybe it was like 10 years ago. I didn't even
mhm,
think about that. And then I have what's called sinus tachycardia. Once I had the TIA, I had the sinus tachycardia all the time. And it was just like her. Everything happened right after my daughter was born. My
mhm,
lupus happened after my daughter was born. So I
mhm,
kind of had the same kind of history that she had. Um,
mhm,
but for me, I noticed that, there's a lot of days I'm really tired. Every day I'm really tired. I can't lie. But I
mhm,
have a heart condition, like especially us that have high heart rates, it's exhausting, right? Your heart's pumping so fast all the time. It's like your body's working out, but it's not really working out. So I have medication for that also. But I did notice I do a YouTube video by a girl named Emmy Wong. It's EMI Wong. And she has maybe 20 YouTube videos. And what I like about them is their step up levels. So like she even has a 10-minute video. And if you only say you only can get up and you feel like you could do 5 minutes, I do 5 minutes. She has, I think her lowest one is 10 minutes and then it goes all the way up to 45. But the
mhm,
45 one is like knocks me out. I'm so exhausted after. Pretty but if I can at least do the 10-minute one she has, I feel so much better as long as I'm doing that 10 minutes a day. And I think it's important for us to realize that even though we're exhausted, that 10 minutes will make a huge difference if you're doing it every day. If you just get up, do the 10 minutes, and you're like, oh man, that wasn't as bad as I thought it was going to be, right? We always are so tired. We're like, I don't want
mhm,
to do that today. I just don't have it in me. But if you could do it and you're doing it at least a couple times a week, I think for me, it personally makes a big difference. And then
mhm,
that's even if I just walk up, we have a small hill in our court, and it's like, okay, I'll walk up the hill and come back down. Just even if that's once a day, because we're so tired. But I notice the more and more I do those small little things, I can kind of build up to, then I'm on the next 15-minute video. You know what I mean? So I think if we can just push past the exhaustion sometimes, we'll feel a lot better, in my
yeah.
opinion, anyway.
Yeah. So I'm kind of hearing a trend of what you guys are sharing of like you feel so tired, but the exercise actually gives you energy and it helps you to do more. So Amber, for you, you're taking your walks and then you're doing your videos. Is there anything else that you're doing to for exercise or fitness?
Well, those videos, I mean, I have small weights. I mean, I encourage like the really tiny, tiny weights, even if they're 2 pounds. I do the small arm ones. I love the bands that Mary Kate was talking about. And I also have the ones that you hook onto like a bathroom door that you can pull, and every single band has a different weight. So I start off at the lowest weight and I'm just using those just to keep, because you don't want your muscles to get where they're so weak where walking is hard. So that's what happens, right? I'm not going to say it's atrophy, but the more tired we are, the less we're doing, our muscles lose strength, right? So it takes a little bit to get that back. That's why I think it's important, even if it's just 5 minutes a day. I mean, I think even 5 minutes is huge if you're not doing a lot.
Mm.
So I think the bands are good. The ones that you put on the door, even the ones that they give you at physical therapy, light weights. I can't always walk. I have some other health issues. I have a lot of calcification in my hips and my body. So I just had hip surgery a year ago, ankle surgery, and probably I'm gonna have to have another shoulder surgery. So these kind of things are easy for me when I'm having flares. I can manage the little workouts during a flare where, at least I can do that. Where
Yes.
maybe walking that up the hill, that's not going to happen because
Yeah.
my ankle will just swell up or my hip will swell up. So I'm like, okay, that I can't do today. But these little
Mhm.
weights I can do today.
Yeah, yeah, you see what you can fit in.
Yeah, because I mean, we used to hike all the time and bike ride all the time. So my daughter and I will still go hike a little bit, but we do a low impact hike.
Mhm,
But,
mhm.
I still do it with her. There's days where I'm like, I'm just going to do it. I know I'll pay for it later, but I'm going to do it. You know, I won't be doing that tomorrow, but today I'm going to do it, and I
Yeah.
think even if people can get in the water, I think water aerobics, even the light water workouts are really good.
Mhm, mhm. Absolutely. Anyone else? I'd love to hear just kind of what type of exercise fits into your life right now.
For me, the weird thing is when I was diagnosed with lupus, my whole life I've been very, I guess I love playing sports and stuff. So high school I did track, softball, tennis, anything where I can be as active as I can be. And then even when I was diagnosed with lupus, I could still, it was kidney involvement. And so I still felt normal, but um I could still like mountain bike, I could still skateboard, I could still snowboard, everything. But then um when my kidneys started failing, that's when everything for me with being basically active stopped
Mhm,
because I got really sick when I was 37, and then that time, like at 15, I almost died. At 37, I almost died because from long-term medications to immunosuppress my lupus caused CNS lymphoma. And then eventually in the hospital, I developed MRSA.
no.
So with MRSA, I had 2 weeks to live. With
Mm,
the CNS lymphoma, it was cancerous lesions in my brain. I had 6 months to live. And
mm,
so with the CNS lymphoma, it caused foot drop and lack of balance. So it just
mhm.
completely changed my life.
Yeah.
And with that long-term life of lupus nephritis, um, that's when I got a heart attack. And
Mhm,
so when I was in the ER, as the cardiologist, who's actually my cardiologist, he was at the ER, and so he explained to me, I was in tears. I was like, I don't know why I'm having this heart attack. I'm doing everything right, because this is when I was doing plant-based exercising for several years, and he's like, well, you had long-term kidney involvement, even though, for over 20 years, and that's what caused your heart attack, because the kidney involvement can also affect your heart. And so, because the kidney is full of blood and the blood is dependent on your heart,
mhm,
so it's really interconnected. Of course, everything is interconnected with your heart and your brain, but he made me feel better because like, well, it was ridiculous because I'm 54. My dad had a heart attack at 52. My brother had a heart attack at 56. Both of my cousins have stents. I had a stent put in. I one my right coronary artery was blocked, 100% blocked, which
mm,
surprised me. I was like, you know, when I'm doing everything right and I was being active my whole life, I
yeah.
don't know why this happened to me.
Yeah.
And so And now, like you heard me, with the kidney transplant, it's getting affected by the medications I'm taking for my heart.
Mhm.
And so we get teary, but
Mm,
it's, I want to protect my kidney.
yeah.
And some, um, it's just difficult because when I was 37, my kidneys failed. And
Mhm.
so they were trying to prevent me from, so it was, and then at 2013, I got a kidney transplant.
Mhm.
And so I've had a kidney transplant for now it's maybe how many years? Like 12 or 13 years now.
Mhm. Mhm.
But it's just difficult because of course everything happens to me. Uh, so it's been challenging, but my heart is great. Like I feel active. Um, I've always felt active. It's just trying to get back to, like when I was playing softball, when I got really sick at 2007,
Mhm.
my captain of my softball team would say, "Can you run yet?" Because the problem with the CNS lymphoma, I can't run anymore. The
Mhm.
the foot drop, CNS lymphoma causes foot drop and lack of balance.
Yeah.
So that kind of wrecked all my active life. So
Yeah. Is there
yeah.
anything you are able to do these days?
I could ride a bike if my husband holds the bike. He's like, "Okay, go." And he pushes. It's like learning how to ride a bike again, So,
Mhm. Mhm.
so I do have balance when I start pedaling and I could ride. But
You get
then,
going. Yeah.
and when we're at the end point and we want to turn around, or I want us, if we have to stop because there's like something blocking our path, I
Yeah.
say, "Dad, you have to help me stop because if I try to stop on my own, I'll fall over."
Mhm. Mhm.
So that I can do. I could walk my dog. I could
Mhm.
ride my bike. I have a bike trainer, so it keeps it stationary. I
Yeah.
could change the tension that
Right.
can be harder. So I could do that. I do like what Amber said, I have 2-pound weights.
Mhm.
So with the cardiac rehab, uh, we watch a video, we talked to this woman, an RN, who told us you need to exercise. So you got to do strength training and cardio. So my bike is my cardio, and the strength training is the 2-pound weights and doing arm and leg lifts and stuff like
Yeah.
that. So.
Nice.
So I'm trying to do as much as I can as far. And when you exercise, the endorphins start going, so it makes you
Mhm.
happy.
Absolutely.
Yeah. So,
It gives you
so
energy
yeah, it
to
gives
do
you
more.
energy
Yeah.
and it makes you happy. So
That's the best
yeah,
part.
that's the best part. So
Thank you for sharing.
of course.
Amber, there was a sorry, were you going to say something else, Yvonne?
Oh, that's it.
Oh, okay. There was a couple questions for you, Amber.
Oh, sure.
Anonymous attendee says, is the thickening of your heart HOCM?
Oh, I don't. He's only ever told me that I have thickening of the heart wall. I don't know that he's ever like gave me a diagnosis like that. I'm not
Mhm.
sure that I've ever. I'm sure it abbreviates for something. Are they in the chat? Does the,
Yeah.
yeah, does the abbreviation stand for something?
Yeah, I'm sure it does. And the other question is, do you take mavacamptin?
No, I've never taken Malvacampton before.
Okay. We're going to get an answer to that question of what HOCM is. The
Yeah,
other question is, what pain do you have that's intermittent? Did you mention you have some intermittent pain,
the chest pain.
chest pain?
Yeah, the chest pain. It's pretty bad because when you have that inflammation, whether it's the lungs or the heart, it's
Mhm.
very painful. I also have costochondritis, and I have it where my ribs will pop out of joint, so in the chest.
Mhm.
So sometimes I'll have that and the thickening at the same time, and it's pretty painful because you can't do much when the ribs pop out. Like I can go to the emergency room, they can pop them back in, but that's all due to, I think, that all being really inflamed all the time. So the
Mhm.
pain is when I have either the pericarditis or the endocarditis or the costochondritis, it's severely painful for me. It's like it hurts to even breathe, and it's hurts to lay down flat, certain levels of how you turn your body. Um, I'm a bigger chested person, so
Mhm.
for me to move sideways, that weight moving puts a lot of pressure, and that even causes pain. So it's
Mhm.
like laying with a lot of pillows propped up.
Yeah.
Yeah, the pain's pretty bad when I have the inflammation of the heart for sure.
Yeah, I was gonna say it probably makes it hard to sleep.
I looked up HOCM and it says it's hypertrophic obstructive cardiomyopathy.
Okay, yeah. Then yeah, I've heard that before. He's talked
Yeah.
to me about that before. I just
And
I
it's a
didn't know there
condition
was an
where
abbreviation.
oh, sorry.
I didn't know there was an abbreviation, you guys. I'm sorry. Yes, he has talked to me about that before.
It's a
Okay.
condition where the heart muscle thickens, particularly affecting the I can't read these words, interventricle or septum and ventricles.
Yeah,
Mhm.
that's it. That is it.
Okay,
I just didn't take the medication that person mentioned for that.
yeah, probably something different that you're taking.
Yeah, I take a water pill for it, and then I take hydrochlorothiazide and then a amlodipine for that, both.
Okay. Thank you. And then Mary St. Francis, do you want to share about your activity, like what you are able to do? You mentioned the cardiac rehab that you go to.
I also was swimming for a while and I loved that.
Mhm.
It was in a physical therapy pool that was hot, you know,
Oh,
warm.
nice.
And but I had to stop because they the engine on the pool broke and the water wasn't warm enough. And if the water's not warm enough, it's just too cold for me to be in there.
Mhm.
So I haven't been able to go back. I just called them yesterday to see what the temperature was. And now they've set it so it won't go that high, you know.
Oh.
So,
Yeah, I
and
love swimming too.
yeah, it was really great. I had a routine that they had given me to just for physical therapy because when I first went to physical therapy, I couldn't stand up. I couldn't do things from in on my feet. So they put me in the pool and I could do anything in the pool because, you know, you're weightless and you can do the exercises far easier. So I was really enjoying going to swimming 2 days a week and the cardiac rehab 2 days a week. So I'm still looking for a pool that's warm. I've been just calling, you know, every day I call a couple, see if I can find one that I could go to uh,
Yeah.
because this is really good. Just walking in the pool is great exercise.
Absolutely.
And I miss it. I feel like I haven't had as much, um, I could get more from exercise by doing that if I could
Mhm.
find one.
Yeah.
Somebody said just get a wetsuit and wear a wetsuit. That'd be pretty, I don't know about
Yeah.
Well, it is going to warm up soon,
that.
so hopefully the pool will feel good.
Yeah.
I think the pool does a lot of good because when I had the TIA, I had
Mhm.
a lot of numbness on my right side where I would drop my, I would be not a foot drop like she has, but my whole leg would give out and I would drop to the ground. So for a while there, the pool was the best thing for me. And I actually did that at a local gym that I could try to afford through there. That way, at least I could do the walking like Mary Kate's talking about, because at that time, that was kind of all I could do. I didn't have a lot of strength in my right arm or my right leg. Like I couldn't even hold my daughter on my hip because sometimes it would give out.
Mhm.
So the pool was one of the only things at that time I could do. Even if it was a hot tub, I know she said not hot water, but for me, if you could even, your friend had a hot tub, you could just be, jogging in there, walking in there. It was a lot easier to be able to get some kind of exercise out of that
Mhm.
if it's available to you.
Yeah.
And
Yeah.
since I have AFib, one of the reasons I'm always tired is because my body thinks I'm in a in a marathon, in a race.
Mhm,
And your
mhm.
heart is beating so fast all the time that you're just worn out from that.
Yeah.
So what I've been trying to do now to make up for the not swimming is I have a walker that I don't need to walk with it. I don't use it in the house or outside really. But if I'm going to walk around the neighborhood, I take the walker because the herbs and things in Santa Cruz are very uneven. And I'm at high risk to fall, and I don't want to fall and break something.
Mhm, mhm.
My bones are, I've taken prednisone all my life since I was 21, so my bones are not wonderful. And but if I take the walker, I can go all over. And if I get tired, I just turn around and sit down on it. And I'm out in my neighborhood looking at everybody's flowers and things. And so I've added that this spring, once the weather got nice, to do that on the days that I don't go to cardiac rehab.
Yeah.
So, like I said, I don't have any more energy than I ever did. I
Mhm,
still feel when I go to get up in the morning, I don't know if I'm going to be able to stand up, but I just do it to just
mhm, mhm.
ask for God's help and go ahead and do it.
Yeah.
And it seems to work, or it's working so far. And,
So far, so good.
right.
You for sharing. I want to share a comment that Kathy Ree has shared here. She says, "Thank you for your stories. Your vulnerability is helping me and others. I was diagnosed at age 13 and now I'm 58. I've had a full career with lupus. For me, I take 2 dance classes weekly, tap and hip hop. I've had 2 hip replacements and probably a knee replacement this year. I will keep going." That's inspiring. Thank you, Kathy, for sharing. Yeah. And everyone's experience is so different, and that's why it's so lovely to be able to share, because how lupus affects all of us in really different ways. Another question I had is, have you learned about anyone in your family that has a history of heart disease or any related conditions?
As I
Uh,
mentioned earlier, oh, sorry. As I mentioned earlier, my cousins have stents like me.
Mhm,
My father had a heart attack at 52. My
mhm.
brother had a heart attack at 56. I'm 54. I just had a heart attack at March 11th.
Oh.
Um, uh, my aunt who passed away, she had a heart attack too. Plus she
Mm,
had diabetes. So
really different
um,
in the
it's
family.
my husband asked if my grandfather on my dad's side um had a heart attack, and it's hard to, I don't know, because when I met him, he was 94 in the Philippines. So it's hard to know how he died. I wanted to ask my mom because, my father's passed away. And it's not from a heart attack. He had a stroke, but he died from cancer.
Mm,
So it's mostly on my father's side of the family where they have heart issues, not just having heart attacks or stents. They just in general, have heart issues
mhm.
and diabetes.
Yeah. I
Yeah,
was just reading an article about how important it is to learn your family's history while they're still alive. The elders in your family asking
yeah.
them about what their parents died of or their grandparents,
Yeah.
so you can have that information for yourself and if you have children.
I also learned that I think I'm a Filipino, and so the diet is very greasy,
Mhm.
and so uh, it could be passed down from generation to generation with all the grease in your body and
Mhm.
the cholesterol.
Mhm.
Except in the Philippines, they eat healthy there. I don't know. It's the American diet. The Filipinos here in America, since they're exposed to more, like processed,
Yeah.
ultra processed foods, these seed oils
Mhm.
that people think are good for you, but they're not really good for you.
Mhm.
Because that's what I'm paying attention to. I don't eat anything that comes out of a box. Ultra processed foods. I look at ingredients in the anything that has added sugars, I don't take.
Yeah.
I don't eat.
Mhm.
So I do look at food labels. I look at how much sugar. I avoid sugar at all costs, except I do have a treat maybe like once a day, like a cookie or something like that,
Mhm.
because I can't avoid it. I used to love ice cream, so that's the thing that I try to do is when I first went plant-based, I lost over 20 pounds and I went down, I was 142, I went down to 118.
Wow.
So now I'm stable at 125.
Is that a more ideal weight for
Yeah.
you? Yeah, for
Yeah,
you.
I think so.
Yeah.
But I would like to be 120. So just to feel, feel more light.
Thank you for sharing.
Yeah.
In my family, there has been some heart issues, but not a lot. No cancer whatsoever on either side, which is pretty amazing.
Mhm.
But as far as lupus goes, I was the first one, and none of my children have had a problem with it. I have 3 girls and a boy. Nobody got lupus,
Mm.
but each of my 2 older brothers has a daughter with lupus.
Oh,
So it is in the family, and it seems to come from the male side. So although my paternal grandmother had diabetes, she was gone before I was ever alive. I'm the youngest one in my generation. And my brothers are 90 and 88, and my sister is 82. So we've all lived a pretty long life as it is. But there has been heart, if anything, it's heart, issues. So aunts and uncles, one of my nephews died quite young of a heart attack, and he was, not even 50, and he had no idea that he had a weak heart, and they found it after he passed away.
Mm.
So, but I agree that it's very good to find out about your relatives. And I feel badly that I have 2 nieces who have lupus, and they haven't had it as severely as I had.
Mhm.
I had uh, kidney involvement 20 or 25 years ago that I was in the hospital for 2 months,
Oh.
2 months literally at Kaiser. And, but I got through it. Took a whole year after I was out of the hospital before I was back to my normal self again in terms of exercises and, health wise. But we haven't had any other illnesses, which has been a blessing. We haven't had people dying young. So, but it is good to know your medical history.
Yeah. Yeah. Would you like to share, Amber?
Yeah, sorry, I moved. My cats were a little loud out there. For me, for heart conditions, my grandfather had a stent put in. Um, and I did learn a little bit more. My grandpa is one of 21 kids, so with 2 wives. So I learned that not his per se direct sisters or siblings had heart conditions or lupus, but the younger ones, my cousins, my direct cousins or my second cousins, they have a lot of lupus on that side of the family, which is interesting. She said it's male because it's all on that side of the family, and then I'm the only one in my family. None of my mom's sisters, my dad, their family, my brother, none of them have lupus. I was the first outside of the second cousins.
Mhm.
But my brother does have an irregular heartbeat, and him and my dad and my grandfather all had high blood pressure or hypertension too. But that's the only heart part. I
Mhm.
think I carry more of the heart issues than anybody. I think I have the most. And then, unfortunately, we didn't get marked levels for my daughter to have lupus, but I also have the common variable immune deficiency on top of lupus, and she carries the markers for that. And she also has heart condition. She has POTS. She has two valves coming off one side of the heart versus one valve coming off both sides of the heart.
Hmm.
And then she has what's called a myocardial bridge. So she has a lot of heart things. And like right now, she's dealing with POTS, and I think it's called autonomic. I think it's called like autonomia, dysautonomia. So it's a lot of heart conditions for her. In the last year, we figured this out. So she does not have a lot of energy ever. Her heart rate, if she sits up, she's already at 170 without even walking. So, that's why those workouts are really easy for us to do at home, because it's not a lot of work for her, because she can barely get up the steps sometimes. And her heart, part of that condition is that she will pass out. So we'll be walking and she'll look at me and go, Mom, I don't feel good. And then she passes out on me. So she's passed out in the street. She's passed out walking. She's passed out in the middle of school somewhere. She just collapses.
Yeah.
And it's the same condition that you see these, a lot of times it's in higher sports players, but you'll see soccer players who die on the soccer field in the middle of playing. That's the same condition.
Hmm.
So she's
Wow.
going to have to always avoid like high intense sports. She cannot play soccer or any of those things anymore. So I think that her and I carry probably the most heart condition issues of anybody.
Mhm, mhm. What you were describing with the two valves on the one side, that's probably something she was born with, right?
Yeah, she was born with that, but we didn't know about it till last year.
Mhm,
When she started having all these issues. And they actually
mhm,
told me that a lot of these issues you wouldn't notice until you're in your teens or older.
mhm.
So we wouldn't have known it. They wouldn't have checked her for that when she was a baby.
Yeah,
Yeah.
yeah,
It's
they
just
have to tell
now
you.
becoming problematic as she's going to be 15 this year. So, and she played sports her whole life. She's always been a competitive league soccer player. So it was really interesting that all of a sudden this hit her.
Mhm,
Actually, it was a lot of it happened after mono. She got mono, like a post-infectious disease kind of thing. I think the mono just attacked her immune system and her body so harshly that it triggered that problem.
mhm. Interesting. Okay, thank you. And how old is your daughter?
She'll be 15 this year.
Oh,
Yeah. So we will keep testing her though, because she
mhm,
still has the signs for a lot of the lupus things. She still has the markers for the um, immune deficiency. I actually have two different kind of immune deficiencies, and she has the markers for that too.
mhm.
So
Gotten a lot of different answers over the years about whether or not lupus is directly passed down that way from parent to child. I've seen evidence of it having been, but I've also seen, like I could say for myself that nobody in my family has lupus. So it's hard to know, I guess, but testing and awareness is really important.
Stanford does offer testing for it.
Yeah.
If that helps anybody. And what I love about Stanford is they're Medi-Cal approved. So if you're on Medi-Cal like us,
Mhm.
Stanford's a great option to have as your medical person. Um, but they do have testing. They do genetic testing for that specifically, and he'll continue to test her. Can't do it every year, but we've done one a couple years ago, and we'll probably do one next year after 3 years to see if
Mhm.
anything else has come forth or if she's got more signs for it. But they do offer that kind of testing, and it's just a simple blood test.
That's great.
Mhm.
That's wonderful. And Stanford is you're getting the best care too.
Yeah, actually, almost all my doctors are now Stanford. I only have a couple at El Camino or through like Good Sam. Like my cardiologist is part of Good Sam, but I also have a cardiologist now at Stanford when I had the blood clots. So um, that care there, I just like that they're next level. With her heart condition, they're always offering testing. Even if they don't offer it to children, they'll send her to the adult clinic and she can get the testing done there through an adult doctor. And then she goes back to her pediatric. So I think that's what I like about them is they offer a lot of testing that I can't get anywhere else.
Yeah. Yeah. Sounds like they go really in depth, which is
Mhm.
wonderful. So we have about 5-10 minutes left. I'd love to just ask one more question. So we know lupus is obviously a disease that has remission and flare periods, and a lot of us can say, like, at some point in my life, I've been really sick and now I'm doing much better. I'd love to hear from just a couple of you, kind of like, how have your symptoms changed over time, and how has that affected your day-to-day life?
Do you guys want me to go first?
Oh, sure.
Okay, I was like, I'll go first. I have the ups and downs as well. I struggled to fight to be on disability. So, I don't know if anyone was at the gala, but I was the face of lupus this year. So I talked about it at the gala that, it took me 9 years the first time to get approved and paid. And then I've been fighting it now for 3 years again. I got really sick 3 years ago. On top of my lupus, I had an infectious disease. So I was at infectious disease at Stanford, and that triggered my lupus to be pretty severe. And so was my immune deficiency. So I feel like it kind of goes up and down. There'll be times where I can work and I do pretty well. And then there's other times where, like, when that happened, it was like one thing triggered another thing, triggered another thing. And then it was like kind of a downslope for quite a while. And there's been periods of time where I'm truly sick. I think in 2013 to 2016, those 3 years was pretty brutal for me. And it was 3 years of constant issues. I talked about this at the gala too, is that I just had my 40th surgery.
Mm.
So it affects me in a way where I'm constantly having to have these so random surgeries. And you have them back to back. I think I had 11 surgeries in 18 months. And so they're like, one surgery barely healed, another surgery barely healed. And they don't all want to say, oh, it's because of a lupus flare, but I tend to believe that it is part of it. I think they don't want to say that. Um, but I think that I have these problems of inflammation and stuff in so many areas of my body that it's causing so many surgeries. So I think that for me, it goes up and down. But then I have friends like my friend Joanna, who hers is pretty consistent all the time. She doesn't have a lot of relief. She has kidney, she's on, stage, I don't know if it's stage 2 or 3, it's 3 kidney failure. My friend Emmett, he's in dialysis right now waiting for his kidney. So I think it just depends on where you are in your lupus, or if you're a nephritis. Mine is I think I've been at level 2 and then kind of dropped back to level, like a more healthier nephritis levels. But mine is always more organ involvement. I don't know about the other people, but my lupus tends to affect my organs versus like skin. I don't get the rashes. I don't get a lot of that kind of stuff, but I've always had more organ, like brain, heart, kidneys involvement than anything else. So I think it's just, if I said there was a constant, it's a constant up and down. I'll be good for a couple months, then it's horrible for a while, and then it's good for a little while, and then it's horrible for a while. Whereas some of my other friends, it's pretty constantly horrible for a while. Yeah. And my longest period, I think, was that 3 year period where I was just so many surgeries and so sick all the time.
So for me, like I said, even though I was diagnosed with lupus, I've been able to be active. And the only times I notice when I have lupus flares was when I was stressed. So when I lost my first job at a high-tech company, I got a flare up, like the flu-like symptoms came back, the joint pain came back, and that was one of my flare-ups that I remember. The other time was I had a acute kidney failure. I was working for myself as a web designer. I had like 24 clients, but I'm not working for all of them at the same time. But because for me, I wasn't taking care of myself. Because like I'd be at my desk in my bedroom just working, and I didn't even stop to eat. I didn't stop to move or do anything like that. And so I think that's what caused, it's a form of stress too. And
Ongoing
then,
stress.
what was the other one? What caused that major, the major one in 2007? I can't even remember, but, it's always like a major flare, like it's not like, well, the first one was losing a job, and then I just had that, typical flare where you have lupus, flu-like symptoms. But the one for the 2007 where I got really sick was, I think I was still working for myself, and then it just happened, it was like not taking care of myself.
Yeah. I've heard
So,
a lot of lupus flares. People say they can link them to like a traumatic experience or a period of like ongoing chronic stress.
yeah,
Like we know stress is one of the biggest problems that takes regular patients, not even lupus patients, to
yeah.
go see their
The
doctor.
weird thing was, I had a job where I loved, and I'd stay up late, work, and do all that stuff. But I was constantly on prednisone. So, in pictures of when I was at that job, we'd have parties. One picture I was like really thin, I look good. Other pictures I have that moon face because I was
Mhm.
on high prednisone. So I
Mhm.
thought that was interesting. Even though I love the job, I think my body was stressed from still not taking care of myself. So,
Are you
it,
able to work these days or have you found
yeah, I'm on
yourself-
disability, so you
Okay.
can work. Um, so there's a certain amount that you can't make over, or else they'll take it away from, they'll reduce
Mhm.
the disability payments.
Yeah, yeah.
But yeah, I'm still working. I have 2 clients that I'm working with. It really reduced from 24, so
Seems more manageable.
yeah, it is.
The amount's really low. I think it's 1150, something like 1200. It's really low.
Yeah,
But you can make a month.
You can make a month on disability because they want you to try to have some kind of work, but I think you can't exceed, I wrote it down, it's either 1130 or 1200, 1230. It's pretty minimal.
yeah.
Yeah.
First it was like 940 for a while. Now I live in San Francisco, so now it's 1940.
Yeah.
But
Because of the cost of living and
yeah.
inflation. Yeah.
But it's weird. I learned how to manage, you know, I made a budget. I said, okay, and so thankfully I'm my husband too. So we work out a plan, like a budget plan,
Mhm.
but sometimes it doesn't always work. So
You get surprises.
yeah,
Yeah.
good thing I have a savings though. So
Yes.
When you asked the question about what causes, the lupus to flare or, has been up and down, in my case, it's stress.
Mhm.
And it took me many years to figure that out. But, and it's mostly emotional stress.
Mhm.
I'm really good with daily stress, like from a job or the house or something. But if
Mhm.
anything happened to one of my children or there's some problem, emotional problem going on, that's just killer for me.
Yeah.
Just, um, turn this off. It just brings on a flare almost.
Mhm.
So over the years, I've tried to get over that, to try to work through those things so that it wouldn't do that to me. And I have made some progress because I know my husband passed away from cancer, stomach cancer, and he had never been sick a day in his life.
Mm.
All of a sudden, he came down with stomach cancer and he only lived a few months. And
Ah,
all my kids were so sure I was going to have a lupus flare
yeah.
because that's the kind of thing that'll do it for you.
Yeah. Yeah.
I didn't. I didn't. I just told myself, I have to get through this. I can't have both of us, him sick and me sick at the same time. It's not going to work. And
Mhm.
he took care of me all my life. So
Mhm.
but it's definitely stress. And so once when I applied for disability, I got it almost immediately. They took it from the final report from the hospital when I was there for the 2 months with the kidneys. And I got it with no trouble. But then at 65, it ends because that's your work life and your disability goes away. So since then, I have just not had as many flares. I've had all this heart stuff that's added in. So health-wise, I'm seeing more doctors and my life is more involved with medical now than it was for, I had some decades of pretty darn good health and, normal lifestyle for, maybe 10 years at a time. But my 20s and 30s were both terrible. I mean, I was really sick when my children were very young. And I had them bing, bing, bing. They're only 15 months apart. So it was really hard and stressful in the beginning. But as I got older, I really thought I was going to grow out of the lupus. I remember asking my doctor, do you think I'm going to grow out of it? No. He said, don't plan on that. That is not going to happen. So I said, well, it's a nice thought anyway, that maybe I wouldn't have it anymore. But I still have it and it's still affecting me. So I guess I'm going to have it for the rest of my life. But we're better buddies than we were in the beginning. In the beginning, I was trying to ignore it and just act like I'm fine.
Well,
And that doesn't work.
doesn't work, yeah.
So, but what I learned was I could just do exactly what the doctors told me to do and then set it aside. As long as I'm doing exactly what they told me to do, then I can go on about my regular life. And that works well for me. So that's what I'm still continuing to do. Just, do as much as I can and realize that I've had the opportunity to see so many different sides of life now. I'm in my 80s and I'm thinking, wow, I get to be an old person. I never dreamed I would live this long. I mean, they were telling me might not make it till 30 and, way back in the beginning. So I just sort of take it as it comes and be grateful for what I do have. So
I love that. Thank you.
I do think if I can add to what she's talking about, I think it's really important for people to have a way to work on mental health, right? Because I think that stress for people comes in various forms, right? Either that's working, not taking care of, or working too much because you're, like me, I have no choice but to work to be able to survive. On top of my immune system issues, on top of my lupus, on top, right? So I think that there's been times where I've had situational anxiety over not being able to diagnose what's really going on with me right now. Cause you have some flare ups or you have health issues like me. I have so many constantly all the time that it becomes, I wouldn't even say necessarily stressful more than the anxiety of, oh my gosh, what is it? Like, I just want to know what it is so I can work on making it better. Or get to is this something I can take care of? What's my risk to me because I have a child. So I think mental health is really important. I think it's important to be able to understand how to resolve stress for you, how to resolve anxiety for you, because we all have it, right? Whether we want to admit it or not, we all have that. So I've learned that there's a therapy person that I've known for a very long time. And if I need him, I'm on the books with him and we work out ways, whether it's breathing exercises or certain ways. There's certain things that you can do to resolve that anxiety and stress, whether it's going outside is your healing thing, talking about 5 things that you love. Like there's all these different levels of things that you can do to try to focus your mind away from those stressors. And I think that that's really important. I know that's a little off topic, but I think mental health is a huge aspect for a lot of people.
Yeah, no, I think you bring up a great point because alongside all the physical symptoms, is the whole mental part of it, of processing everything that's happened to you, and that's not always talked about. So thank you for bringing that up, Amber. All right, we're gonna wrap pretty soon. Yvonne or anyone, do you want to say any last final words?
I like this group right now. It seems like we were having like a support group, you know, it feels like a support group. So
Yes.
thank you, Mary and Amber,
Yeah.
et cetera, for hosting this, or moderating this.
Yeah, happy to.
So it's great to hear about your heart issues, because mine is all new for me.
Mhm.
So I really appreciate hearing your stories, and I feel like I feel supported through you guys too. So I appreciate it.
Well, thank you, Yvonne. Thank you, Amber and Mary Kay Francis, for sharing your stories and for being so open and honest about, your conditions and what you live with. I know it's not easy to do, and we really appreciate you. And thank you, everybody, for attending today. Don't forget that these videos will be posted on our website, lfnc.org. If you missed the session 1 presentation from earlier, you can watch out for an email link where it'll be sent to you. Please make sure to take the survey that you receive via email. This will help us to find topics which are interesting for you, and then that way we can try to include them in future conferences.
Oh, and before we go, can I tell everybody, if you guys ever need help with the buddy program, I'm part of the buddy program that LFNC has. If you need a buddy, they're wonderful about connecting you with patients like me who support a buddy, or part of the mentor program. I'm also part of that, and the advocacy program. So I feel like sometimes it's hard to be in a group setting and want to talk about things, but the LFNC offers programs where you can have a one-on-one buddy. You can have a mentor if you're new. We're here to help you guys through that too, for some of us who've been around the block for a while. So I want to make sure that everyone in this group, if you're new to something, there are other ways through the LFNC to connect with people that's maybe not in a group setting where it's a little nervous, if you need that kind of support.
Absolutely. That it's a great program, and you can find ways to get involved on the website as well. Our next Lupus Health Conference will be on May 10th, and we're going to welcome back Sarah Gouze. So if anyone has ever heard her speak, she's wonderful. And the topic of her talk is going to be Calm the Chaos, Managing Lupus Through the Mind-Body Connection, which is close to what we talked to about mental health. She'll be followed by lupus patient Julia Viscuso. And they have a really interesting morning plan, so you won't want to miss that. You can sign up on our website now for the next conference. We're also working on our June conference, and we have a Drive Out Lupus fundraiser that Tom mentioned at Topgolf in San Jose on June 29th, if you're able to join. And lastly, to kick off Lupus Awareness Month, we're hosting a coffee and conversation. So you can join the staff at LFNC and our executive director, Tom, for coffee and pastries at the office on May 8th. We'd love to see you, and you can RSVP and find more details on our website, which is again, lfnc.org. I hope you all had a great day today. Thank you so much for joining us, and have a wonderful weekend. Bye,
Thank
everybody.
you.
All very much. It was a pleasure to be here.
Thank you. Thank you for coming.
Thank you.
Bye-bye.
Bye.